Let's start with a classic example of hard paternalism, the raw milk debate. Unpasteurized milk carries a significantly higher risk of pathogens like E. coli and Listeria, which can cause kidney failure and death. Because of this, the FDA bans the interstate sale of raw milk. Many states ban it entirely. Advocates, however, view this as tyranny. They argue for food freedom, the absolute right to consume what they want from farmers they trust. They claim raw milk has health benefits that pasteurization destroys. The state says the risk is too high. The advocates say it is my risk to take. If this were just about competent adults drinking risky milk, the libertarian argument might win, but the ethics get complicated when we look at asterisk, who asterisk gets sick. Often, it is not the adult making the food freedom choice, it is their child. Children are most vulnerable to kidney failure from E. coli. Does the state have a duty to intervene to protect the child from the parent's risky choice? This moves the debate from hard paternalism, restricting the adult, to the harm principle, protecting the vulnerable child. If a parent gives a child whiskey, we call it abuse. Is giving a child unpasteurized milk during an outbreak different? This is where the food freedom argument hits the wall of child protection. Applying the intervention ladder, can we solve this without a ban? Some states have moved to a middle ground. They allow the sale of raw milk, but require massive warning labels, soft paternalism, and rigorous daily testing of the herds. This respects the liberty of the adult consumer while trying to mitigate the risk. It shifts the burden of safety to the producer and the burden of risk assessment to the consumer. This is an example of seeking the least infringement. We don't have to ban it if we can make it safer and ensure informed consent. The policy is evolving from prohibition to regulated permission. Next, let's look at flavored vapes. This is a perfect storm of ethical conflict because we are balancing the interests of two different populations. For adult smokers, vapes are a harm reduction tool. They are 95% safer than combustible cigarettes. Flavors help adults switch. But for teenagers, fruity flavors like mango or cotton candy are a gateway to nicotine addiction. We saw a massive spike in teen vaping. The U.S. response has been to ban flavors, hard paternalism, to protect the youth. But in doing so, are we harming the adult smokers who rely on those flavors to stay off cigarettes? Let's apply the justificatory conditions. Effectiveness. Do flavor bans work? Or do they drive teenagers to the black market, where the products are unregulated and dangerous, like the vitamin E acetate scandal? Evidence suggests that when legal vapes are banned, cigarette sales go up. That is a perverse outcome. Proportionality? Is it fair to restrict the liberty of a 40-year-old trying to quit smoking because a 16-year-old might break the law? The UK has taken a different approach. They regulate vapes as medical devices and promote them for cessation. They focus on punishing the asterisk sale asterisk to minors, rather than banning the asterisk product asterisk for adults. The US approach prioritizes the protection of youth. The UK approach prioritizes the reduction of harm in adults. Finally, we must touch on the lingering debates around vaccine mandates post-COVID. The core logic of Jacobson relies on the vaccine preventing transmission, stopping the spread to others. That is the harm principle. But with later COVID variants, the vaccines became less effective at stopping transmission, though they remained highly effective at preventing severe disease and death. This shifted the ethical ground. If the vaccine primarily protects asterisk, you asterisk from the hospital, but doesn't stop you from infecting me, then a mandate becomes a form of paternalism, protecting you, rather than police power, protecting the herd. This nuance was often lost in the public messaging, leading to a massive failure of public justification. Officials continued to use stop the spread rhetoric even when the data showed breakthrough infections were common. When the justification, do it for grandma, didn't match the reality, grandma can still get it from you, trust collapsed. The public felt gaslit. This illustrates the danger of not updating your ethical justification as the science evolves. We are now seeing a backlash where legislatures are stripping public health officials of powers they might need for the next pandemic, all because the justification for the last one felt dishonest. In all these controversies, milk, vapes, vaccines, the media plays a critical role in destroying nuance. These are complex risk-benefit calculations. But in the public square, they become identity markers. Drinking raw milk becomes a sign of conservative rebellion. Wearing a mask becomes a sign of liberal virtue. When health behaviors become tribal symbols, ethical analysis becomes almost impossible. As policymakers, your job is to cut through the noise. You must look at the data, apply the framework, and ignore the culture war. You must ask, what is the risk? What is the benefit? What is the least infringing way to achieve it? This brings us to the end of Module 3. We have traveled from the Supreme Court in 1905 to the vape shops of 2024. The thread connecting them is the tension between the I and the we. The takeaways are clear. Liberty is the default. Restriction requires proof. The burden is on the state. And without public justification, even the best science will fail. These frameworks, Jacobson, the conditions, the intervention ladder, are designed to protect us from our own good intentions. They force us to pause and ask why and how before we act. Next week, in Module 4, we are going to leave the public square and enter the hospital room. We will shift from population health to clinical ethics. We will ask, does a patient have the right to refuse life-saving treatment? Does a doctor have a duty to keep a patient alive against their will? We will meet Dax Cowart, a man who begged to die, and we will see how his suffering changed the laws of informed consent forever. Rest up. The questions only get harder from here. Thank you.